Hello, my name is Dr. Sarah Lee. I'm a child and adolescent psychiatry fellow at UC Riverside School of Medicine. We're here today to talk about LGBTQ plus and gender diverse mental health in adolescents and children. So we have our table of contents. So some of the things that we're going to talk about today include terminology, aspects of mental health that affect LGBTQ youth, transgender and gender diverse youth, recent policies, including standards of care, caregiver and family impact, as well as resources for LGBTQ youth and their families. So we'll start off first with some terminology. There are a lot of updates and changes to vocabulary over the years, and terminology that was in use commonly 5 to 10 years ago have changed and have been updated and continue to change. So these are just some of the basic concepts in terminology which tell us the difference between sex, gender identity, gender expression, sexual orientation, and romantic orientation. So, sex is often what we use to describe physical attributes, right? And so these can include male, female, or intersex characteristics, whereas gender identity is what you identify as, and this exists as a spectrum. And this can be different from sexual orientation, which is a spectrum of who you are attracted to, and romantic orientation, people who you want to cultivate a romantic relationship with. A helpful slide that I found is a genderbread person, and so it kind of explains some of this terminology on a spectrum. So traditionally we've learned that sex or gender is binary, man, woman, but we now know that these exist more on a spectrum, right? So biological sex, right? There's female, there's male, but there's also intersex, or there's variances in biological sex as well. And so this can be seen here on this slide. And we can see that gender identity and expression can also exist on this spectrum as well. So the identity is kind of how a person identifies in their head, how they think about themselves, if they feel more like a woman or a man, or maybe in between, right? And then the way that people express their gender could be through different ways, whether it's clothes or the way we behave or interact with other people. And so this can go from a feminine expression of gender to a more masculine expression of gender, or somewhere in between, sometimes both. Sometimes people express their gender more feminine, more masculine, some enjoy both, and some don't identify as either. And this is separate from sexual orientation, which is how someone is physically attracted to another person. And so we can talk about that a little more on the next slide. What exactly does LGBTQ plus mean? So this acronym came about to be as inclusive as possible. It started off as LGBT, and now we've added additional letters like Q, I, and A as well. But for the purposes of today's presentation, we're going to use LGBTQ plus. So the L stands for lesbian, and a lesbian is a woman who is attracted to other women. The G in LGBTQ stands for gay. And someone who is gay is someone who is attracted to those of the same gender. A lot of times, traditionally, this has been used when men identify as being attracted to men, but other people of different gender identities can identify as gay as well. The B stands for bisexual, which is someone who's attracted to those of their same gender as well as opposite or other genders. And transgender refers to someone whose gender identity differs from the one that was assigned to them at birth. And queer stands for anyone who doesn't quite fit into the heterosexual and or cisgender identity. Something that's important to keep in mind as we continue is that gender diversity doesn't necessarily equal gender dysphoria. Now, gender diversity simply refers to, the extent to which a person's gender identity or gender expression is different from, what the cultural norms are for people of a particular assigned sex. And transgender people can be part of gender diverse people. Now, gender dysphoria, though, is specifically distress or discomfort, which is persistent because of the discrepancy between the person's gender identity or expression and their assigned sex at birth. So, and AFAB stands for assigned female at birth, AMAB stands for assigned male at birth. And so gender dysphoria is going to be, persistent. It's going to stick around. It's going to be pretty significant. They're going to say, I don't feel comfortable, or I don't feel like the gender that was assigned to me at birth is who I am. We definitely want to focus on diversity and not pathology when it comes to supporting LGBTQ plus people. Unfortunately, psychiatry does have a dark history of stigmatizing or labeling homosexuality as a mental disorder up until the late 1970s. And so as time has passed, that is no longer the case. And the reason why that's important is because stigmatizing LGBTQ plus people, especially youth, lead to worse mental health outcomes. In the past, some of these practices led to reparative or conversion therapy. So this means there were efforts to try and change a person's sexual orientation or gender identity and expression. And evidence shows that not only are they not effective, but they are quite harmful to LGBTQ plus people. And so these practices are not recommended, and evidence shows that they are harmful. So a lot of people ask, why then is gender dysphoria included in the DSM, or why is gender incongruence a diagnosis? And the reason for that is so that insurance companies have a diagnosis to justify treatment. Another concern that a lot of parents, caregivers, families, people in general are questioning is, why are so many more people, and especially children and adolescents, coming out as LGBTQ+. Well, LGBTQ people have always existed throughout history. However, it doesn't necessarily mean that they were safe to be themselves or to live their lives authentically as LGBTQ plus people. And so the recent increase we may be seeing is because of increased acceptance in society, as well as increased representation of LGBTQ plus people. I like to give the example of left-handedness, which was in very low rates because people used to correct children who would show left-handedness and kind of force them to be right-handed. But as that practice died out, we saw a dramatic increase in the people who were left-handed. Did that suddenly mean that there were more left-handed people than there were before? No, it just means that when people were allowed to be themselves and express themselves and be how they were born, we saw those numbers going up, and then they remained steady. So likely the same thing is happening with LGBTQ plus people. Another reason, that we know that gender diversity in cultures worldwide have acknowledged third gender or gender diversity in different cultures. So, for example, in South Asia, in Mexico, and Hawaii, these are just a few examples of cultures throughout the world that acknowledge third genders or gender diversity. And there's actually a link up here through PBS that shows you an interactive map, and you can kind of read up about more of these cultures and the gender identities that are expressed in these cultures. And so now we're going to talk more specifically about transgender and gender diverse children and adolescents. Parents and caregivers are curious to know whether gender dysphoria will persist into adulthood for children and adolescents. And what some of the studies have shown is that for adolescents who experience gender dysphoria, it is much more likely to persist into adulthood as compared to children. And that makes sense when you think about puberty and how that can affect gender dysphoria and probably worsen gender dysphoria. One thing that's important to talk about is mental health in LGBTQ plus and especially trans and gender diverse youth. We know that children and adolescents can have higher rates of depression, of anxiety, of suicidal ideation, as well as suicide attempts. And so that's why it's important that we talk about how we can support LGBTQ plus children and adolescents. Now, an important organization when it comes to transgender health is WPATH, or the World Professional Organization for Transgender Health. They do have standards of care that have been published every few years. And the most recent update was the first update in about 10 years. And in this new standards of care, there are separate chapters related to adolescents and children because they acknowledge that there have been an increase in the number of transgender and gender diverse adolescents and children. There are different categories of transition. One category is social transition, and another is physical transition. So social transition is anything that doesn't have to do with medical procedures, medications, or surgeries. And so this can simply mean changes in gender expression or role or identity. For instance, changing their name or gender marker, and or changing their clothing and appearance, using binding or padding to look more like their gender identity or express gender. Whereas physical transition usually involves medical or surgical treatments. And these can be divided into 3 different categories, which are fully reversible, such as puberty blockers or puberty suppressors. These are often used while, a teenager is wanting to put a pause on puberty while they explore their gender identity or gender expression. Partially reversible physical transition includes hormone therapy, and then irreversible treatments are usually surgery. As always, there's risks versus benefits of any decision. Anytime there is medical or surgical treatment, there are weighing of risks versus benefits. There are potential side effects or adverse effects of medications. because of puberty blockers or because of hormone therapy, as well as outcomes that might not be reversible because of hormone or surgical treatment, including reproductive or fertility side effects. However, it's important to remember that no choice is completely neutral or without risks. Even choosing no treatment or no gender-affirming treatment is not without its risks. Withholding medical or physical transition access or treatment can prolong or intensify gender dysphoria, can worsen mental health outcomes, and oftentimes it can be a matter of survival for gender diverse people. Now, another topic that comes up frequently is regret and or detransition. It does happen, but the rates of detransition are fairly low. In general, reasons for detransition are varied. Some of them are for internal reasons, such as, changing gender identity or fluctuation, or it might be due to external factors, which is much of the time, such as unaccepting social environments or falling out of care. There are not a lot of long-term follow-up studies for people who have transitioned, especially from adolescent to adulthood. But the biggest Dutch study did show that there was a pretty low rate of detransition and overall improvement in mental health and general outcomes for people who took part in gender-affirming medical and surgical treatment. And so when working with adolescents who are transgender or gender diverse, their recommendations are always to work with healthcare providers who are licensed, have training and or experience working with gender diverse adolescents. And as always, any decision-making process involves, the adolescent and their parents and caregivers. I think there's been, unfortunately, a lot of misinformation about, what gender-affirming care means. And it's always going to be a decision that involves parents and caregivers when we're talking about minors. And so that's very important to know. And any recommendations for treatment have to follow certain guidelines. For example, the recommendations are that in order to start any treatment, we want to see that the adolescent is experiencing gender dysphoria or gender incongruence, which is persistent over time. Okay. Also that the adolescent needs to demonstrate they are emotionally mature and cognitively mature to have informed consent for treatment, and that any mental health concerns that can interfere with capacity to consent or diagnostic clarity or gender affirming treatments should be addressed. And so they need to be able to understand the risks and the benefits, including reproductive effects, if they choose to go through with gender-affirming medical or surgical treatment. And they need to reach Tanner stage 2 of puberty to start puberty suppression, and at least 12 months of gender-affirming hormone therapy is suggested to achieve surgical results required. So again, this is many-step process. Is not something that can be done, overnight or just at the drop of a hat. For children, the most important thing is having a safe space and supportive family environment so they can explore their gender and provide age-appropriate education, especially as children approach puberty. And we recommend that parents and caregivers and healthcare professionals be supportive to children who want to be acknowledged as the gender that matches their internal gender identity. Something that is also important to note in our day and age is that we're seeing a lot of news about gender affirming care, about transgender youth, um, and that means there's a lot of media attention on this. There have been a lot of pushes to increase legislation on LGBTQ, particularly trans youth. Even though evidence for most medical associations show that gender affirming care is helpful for youth. So if you can see here, there have been a lot of increases in the number of anti-trans bills that have been introduced. Even in this timeline, you can see that the number of bills continue to be high who are targeting anti-LGBTQ. And even in 2024, we're seeing over 400 bills that have been proposed that are considered anti-LGBTQ+. So why is this important? This is very important because we know that LGBTQ youth, but especially transgender and gender diverse youth, have a higher rate of mental health issues, including depression, anxiety, substance use, suicide rates than the general population. And so evidence has shown over and over again that gender affirming care can be life-saving and it can improve the quality of life of people. So what is the role for parents and caregivers of LGBTQ youth? Studies have also shown that if there's a strong connection between the parent or caregiver and their child, that child is more likely to have good mental health outcomes. Family acceptance is such a key factor, and we know that family or parent or caregiver rejection has a strong association with mental health problems. So coming out is another topic that parents and caregivers ask about. So coming out is a term that's used to refer to someone that recognizes, accepts, and wants to share their sexual orientation and or gender identity with someone else. Coming out is a very personal decision, and many people take years to come out to friends and or family. And so the most important thing that parents and caregivers can remember to do is to let your child come out on their own terms and in their own time. In the meantime, what you can do is to offer open support, take some time to educate yourself, encourage open dialogue, be curious, listen, and above all, to make sure that your children know that they are loved. Some of the behaviors that have been shown to have positive outcomes in accepting their children are educating themselves about LGBTQ plus people and issues, talking with your child respectfully about their identity, openly and respectfully discussing LGBTQ plus issues with your child, supporting your child's gender expression, and this can include things like using their correct names and pronouns, helping them get a haircut or maybe new clothes that support their gender expression, and being welcoming and kind to any friends or partners they may have. And the biggest piece of advice is, sometimes to just ask if you're not sure. And another thing is for parents and caregivers to realize you don't have to know all the answers and you don't have to have it all figured out. Okay, you're not alone. Whatever feelings you have, when, if and when your child comes out to you are valid. If you're afraid, if you're scared, if you're sad, if you're angry, those are all valid feelings. And we want to encourage you to take your time. It's a journey, it's a process. It's not something that is gonna happen overnight. Make sure that there's a team behind you, whether that's, doctors, therapists, teachers, making sure to stay in touch with the school and look out for signs of bullying, and staying on top of social media, because even though that's a good way at times for adolescents to kind of, find a community, it can also be a concern for bullying or other things like that. And finally, I just want to provide some resources for the LGBTQ plus community in Riverside County. So these are some organizations and resources. I want to point out the Trevor Project, because they do have a 24/7 crisis line at the above number, or if you prefer to text, they also have a texting service too. And these are some other resources for family members of LGBTQ plus youth, and these are also in Riverside County. I want to thank you so much for, being present for this presentation today, and hopefully you learned something about, LGBTQ youth and how we can best support them as parents and caregivers and community members. Thank you so much.